As parents, we always want to ensure our babies are happy and healthy. But sometimes, our little ones can't tell us directly when something is wrong. Here are 10 silent signs your baby might be in distress that every parent should know. Understanding these signs can help you identify potential problems early on and ensure your baby gets the care they need. Trust your instincts. If something doesn't feel right, don't hesitate to reach out to your pediatrician. Let's start with one of the most fundamental needs, feeding. A sudden change in your baby's feeding patterns, whether it's eating significantly less or more, can be a red flag. It's often their way of signaling that something's off. If you notice this pattern continuing for more than a day or two, it's time to take note. It could be a sign of an underlying issue like reflux, an ear infection, or even a simple tummy ache. On the flip side, a sudden increase in hunger could indicate that your baby isn't getting enough milk per feeding. Paying attention to your baby's feeding patterns is crucial. We all know babies cry, but did you know there are different cries for different needs? As parents, we become experts in deciphering those cries. But what about a cry that's different? A cry that sends a chill down your spine. A persistent cry that sounds strained, high-pitched, or just plain unusual. That's a cry that should never be ignored. It could be a sign of pain, a pain they can't articulate any other way. An unusual cry is often their way of saying something hurts and I need help. Now, I'm not saying every cry signals a major problem, but if you're noticing a change in your baby's cry, trust your gut. It's always better to err on the side of caution and reach out to your pediatrician. Just like us, babies need their sleep. If your baby, usually a champion sleeper, is suddenly having trouble settling down, waking frequently throughout the night, or sleeping much more than usual, it's time to pay attention. Changes in sleep patterns can be early indicators of distress. Now, I know what you're thinking. All babies go through sleep regressions, right? And yes, that's true. But there's a difference between a typical sleep regression and a change in sleep pattern that's cause for concern. If your baby's sleep changes are accompanied by other symptoms like decreased appetite, unusual crying, or lethargy, it could be a sign of an underlying issue. Remember, sleep is vital for a baby's well-being. If you notice significant or persistent changes in their sleep patterns, don't hesitate to reach out to your pediatrician. Babies are naturally curious and active little beings. But what happens when that energy wanes? What if your little one, usually a bundle of joy and movement, becomes unusually quiet and still? This decrease in activity, often referred to as lethargy, can be a concerning sign. It's like their internal battery is running low, and it's often their way of conserving energy when they're not feeling well. A decrease in activity can be a sign of various issues, ranging from a mild cold or infection to something more serious. Now, I'm not saying that every quiet moment signals a problem. But if you notice a marked decrease in your baby's usual activity level, especially if it's accompanied by other symptoms like poor feeding or unusual crying, it's essential to take note. Consult with your pediatrician. A baby's skin can be a window into their overall health, reflecting changes that might not be immediately obvious. While slight variations in skin tone are normal, any drastic or sudden changes in color should be taken seriously. For instance, if your baby's skin takes on a pale, almost grayish hue, it could be a sign of poor circulation or low blood sugar. Similarly, a bluish tinge around the lips, fingers or toes, a condition known as cyanosis, can indicate a lack of oxygen and warrants immediate medical attention. On the other hand, if your baby's skin appears unusually flushed or red, it could be a sign of fever, overheating, or even an allergic reaction. And then there are the rashes, those pesky, often itchy patches of skin that can pop up for various reasons. While most baby rashes are harmless and disappear on their own, some can indicate underlying medical conditions. Paying attention to any changes in their skin color or texture can help you identify potential problems early on. Breathing is such an automatic function, something we rarely even think about. But for babies, especially newborns, breathing can be a bit more challenging. If you notice your baby's nostrils flaring with each breath, their chest caving in with each inhale, a sign called retractions, or their breathing becoming rapid and shallow, it's essential to seek medical attention immediately. These signs can indicate respiratory distress, a condition where your baby is struggling to get enough oxygen. Other signs of breathing difficulties include grunting, wheezing, or a high-pitched whistling sound with each breath. Now I know this might sound scary, but it's important to remember that early detection is key. By recognizing the signs of breathing difficulties and seeking prompt medical attention, you can help ensure your baby gets the oxygen they need. If you suspect your baby is having trouble breathing, don't hesitate to call 911 or take them to the nearest emergency room. Fever is one of the most common signs of illness in babies, and it's often the first indication that something is amiss. For babies under 3 months old, a rectal temperature of 100.4 degrees Fahrenheit, or 38 degrees Celsius or higher is considered a fever and warrants immediate medical attention. For older babies, a fever is generally defined as a rectal temperature of 101 degrees Fahrenheit, or 38.3 degrees Celsius or higher. While a fever in this age group might not always require a trip to the doctor, it's still essential to monitor your baby closely and watch for any other symptoms. A feverish baby might feel warm to the touch, especially on their forehead, back, or tummy. They might also be fussier than usual, have a decreased appetite, or seem lethargic. If your baby does have a fever, it's essential to keep them hydrated by offering them plenty of fluids. By understanding how to recognize and manage a fever, you can help your baby feel better sooner. Vomiting and diarrhea are never pleasant experiences, especially for a tiny human who can't quite understand what's happening. While these tummy troubles are often caused by viruses and pass on their own, they can sometimes indicate a more serious issue and lead to dehydration. A dehydrated baby might have fewer wet diapers than usual, a dry mouth and tongue, sunken eyes, or seem unusually sleepy or lethargic. If you suspect your baby is dehydrated, it's essential to contact your pediatrician right away. They might recommend giving your baby an oral rehydration solution, or ORS, to help replace lost fluids and electrolytes. In the meantime, focus on keeping your baby comfortable and monitoring their symptoms closely. From those first jerky movements in the womb to the coordinated kicks and punches of a newborn, a baby's movements are a constant source of fascination and joy. But what happens when those movements change? What if you notice your baby making unusual or involuntary movements like twitching, jerking, or stiffening? While some unusual movements can be harmless and simply a part of your baby's developing nervous system, others can indicate a more serious neurological issue and warrant immediate medical attention. For instance, if your baby experiences a seizure, their body might stiffen, their arms and legs might jerk uncontrollably, and they might even lose consciousness. Now, I know it can be alarming to witness any unusual movements in your baby, but it's important to remember that early detection and intervention are key. By recognizing the signs and seeking prompt medical attention, you can help ensure your baby gets the care they need. Eye contact is one of the most powerful forms of nonverbal communication, and it plays a crucial role in a baby's social and emotional development. So, what does it mean if your baby avoids eye contact or seems uninterested in engaging with your gaze? While some babies are naturally more reserved than others, a persistent lack of eye contact can sometimes indicate a developmental issue, such as autism spectrum disorder or ASD, or a visual impairment. Now, I'm not saying that every baby who avoids eye contact has a developmental issue. However, if you notice that your baby consistently avoids eye contact, especially if it's accompanied by other concerning signs, it's essential to talk to your pediatrician. Early intervention is crucial for children with developmental issues, and the sooner you can get your baby the support they need, the better their outcomes will be. Remember, you are your baby's best advocate. If you notice any of these silent signs or if something just doesn't feel right, don't hesitate to reach out to your pediatrician. Early detection and intervention can make a world of difference in your baby's health and well-being. Parenting can be challenging, but you're not alone. Trust your instincts, seek support when you need it, and know that you're doing a great job caring for your little one. Stay informed and stay vigilant.